D,
And
or will, right?
vitamin
That's
D.
what seems to be happening, or will there? Joined now by Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Thank you so much for joining us. We appreciate it. You just heard about the new vitamin D study. Why might this lessen symptoms of the virus?
First of all, Happy New Year,
Happy
Ed
New
Maria.
Year.
Happy
I haven't
New
talked to you in a few days. So we know that vitamin D can boost the immune system. We also know that patients with low levels of vitamin D may have more severe COVID. But no one has proven yet if giving vitamin D is going to lessen your infection rate or prevent infection. So what I really like is the Brigham is looking at this. They're going to do a randomized controlled trial to see does vitamin D actually make a difference in patients who have COVID and perhaps in other household contexts who don't have COVID.
Yeah. So let's talk about the vaccine now. The National Institutes of Health is now looking at data to see if a half dose of the Moderna vaccine may be just as effective as a full dose. So what do we know so far? And what could that mean for that second shot if it's needed at all?
Ed, remember, we have to follow the science here. And the phase 3 trials with Moderna were done with full dose and full dose, okay? So we don't have any data that shows that half dose followed by a half dose works clinically. Is it possible down the road if tested in kids or young healthy adults? Could it work? Maybe, but that needs to be studied. Right now, we have to keep our eye on the prize, and that's a full dose followed by the full dose, just as we've been doing.
Doctor, we keep hearing over and over that we're in this major resurgence of cases here, across the country, across the world. Give us a progress report for South Shore Health and what you're anticipating for cases and patient load in the coming weeks. We keep seeing these field hospitals popping up in places, and they are starting to fill.
Maria, things are really challenging here, as they are for many health systems across the state. We're seeing increased 3 times the number of ER visits here. We're seeing increased hospitalization rates. We have close to 100 COVID-19 patients here. Yes, we still have capacity, but we have to drive down the virus. Otherwise, we're just going to continue to see more and more cases, and it can get to a dangerous level.
And well, I was going to ask you, what about the severity of the cases too, doctor, that you're seeing?
Well, overall, I'd say most patients are doing very well. We still, of course, if you're in the ICU, the intensive care unit with COVID-19, you're fighting for your life. Patients are doing better overall, but it's still, many lives are hanging in the balance when you're in the intensive care unit. Fortunately, it's the minority of cases.
Can we talk about this new variant that we keep talking about? It's identified in the UK. It is Colorado, I believe, first reported it. It's likely, according to the governor, here in Massachusetts. We don't have any confirmation of that yet. It may be as much as 50% more contagious. So what does that mean? And how is this variant getting through? Do you know what I'm saying?
Yeah, so first of all, I think what's important is we have to recognize what happens in one part of the world affects other parts of the world. It is likely that the variant is here. The good news is for an individual patient, you're not more likely to be hospitalized or have a bad outcome. But if you have 100 people that had the old infection, you're likely to have at least 150 people with the new infection. We know that that's going to challenge our healthcare system more. And the more patients overall as a population that are infected with this variant, the more likely there is to be hospitalizations. And the more likely there is to be hospitalizations, the more likely there is to potentially be deaths, just because the numbers are greater on a population level.
Dr. Ellerin, it's always great to talk with you. Happy Tuesday. Happy New Year. Great to see you.
Take care, guys.
Happy New Year. Thank you, doctor. Be well. We appreciate it.
What is it? 9 minutes before 5 right now. Dark